Welcome to Patient as a Case. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Before we get started, please answer 3 quick questions. Per the Jane version, 6 blind men were asked to describe an elephant based on their observations. Feeling a leg, one man claimed the elephant to feel like a pillar. Another man, touching the tail, liked an elephant to a rope. The trunk was described as a tree branch, the ear a hand fan, the belly a wall, and the tusk a solid pipe. Polycythemia vera, along with essential thrombocytopenia and myelofibrosis, are classified as myeloproliferative neoplasms, NPNs. If you were to gather together patients who are symptomatic with P. vera, for example, you would find that all of them share a long list of symptoms. This list includes fatigue, pruritus, itching, difficulty sleeping, day or night sweats, headaches, dizziness, vertigo, abdominal pain, shortness of breath, bone pain, and double vision. These symptoms are well described in the medical literature and are well known by leaders in the medical field. Pressed for time and not able to commit to a detailed history, however, imagine if a provider limited the patient to only three complaints. Imagine if the symptomatic P. vera patient was permitted to only discuss fatigue, difficulty sleeping, and day and night sweats. Would you conclude menopause? What if the patient described horrible itching episodes that are accompanied with shortness of breath and vertigo? Would you consult a psychiatrist if a pulmonary function test was normal and antihistamines had no effect? For such a patient who experiences consequences of the condition, such as a blood clot or a stroke, an effective diagnosis and treatment plan could still be elusive. By limiting the patient's expression of concerns, the provider sets himself or herself up for failure. The providers could see this patient time and time again and miss the big picture. Whether the provider chased each symptom with tests and specialist consultations, or whether the provider scoffed the complaints as trivial, unless all of the subjective concerns are documented, the patient is still left without an accurate representation and without an accurate diagnosis. We want the patient's history to be detailed, not just for big data, which wants us to define all the information variables, but also for ourselves. When seeing a patient with multiple symptoms, we need to be careful not to limit the patient's subjective story. We need to document a complete patient case. Now, doctors are trained based on clinical cases. Some medical schools today have curricula that are entirely case-based. On board examinations, most questions describe a patient as a case. A case history tells the story of the patient so that the test taker has enough information to choose the correct answer. Now, this is not to say that patient care is limited to a test question. In clinical practice, the succession of patient encounters with the doctor transforms each case presentation into a description of the patient's experience. If you cannot figure out what's going on with your patient today, perhaps someone else might be able to, or you might be able to over time. But the information needs to be documented in the health record. Patients with diseases are now assembling in forums. They meet physically at meetings, while many participate in private online chat rooms. Some patients, frustrated with their care, are recording their medical encounters and posting the videos online. Imagine when patients start to post the video and the documented record side by side. Now, you may rightfully claim that recording, whether video or just audio, is illegal in many states unless both parties agree. And while this is true, the court of public opinion does not care. Plus, many videos outside of healthcare are shown on the evening news with little debate about consent. The advent of technology in the practice of medicine was not to exclude the patient concerns, but there is evidence that this is happening. As an unintended consequence of opening Pandora's box, our healthcare system forgot to involve the patient. In our attention to regulations that require us to click one more box after another, little time has been left to hear and understand the patient's story. If you are thinking that you did not have the time to ask all the questions and a detailed history, wait for responses, and then type them into the computer, you are absolutely correct. Yes, there will be times when you will conduct and document a detailed history yourself. Most of the time, however, your patient is willing and able to do the work for you. Thank you for participating in this module. In the next module, I will show you how to hear and understand all of your patient's concerns and have it documented in the health record while reducing your workload by 33 to 50%. Before we go, please answer these quick questions.